Mr. Ngala, thank you so much for your time and welcome to ENCA. Just please give us some context as to what exactly the report exposes.
Good afternoon. Good afternoon to the viewer. So between the period of 2012 and the end of 2019, we have collected approximately 700 whistleblower accounts of corruption in the health sector. And in all of these cases, people are talking about how corruption has had a devastating impact on the lives of ordinary people and also the effectiveness of the healthcare system. Topping these reports are employment corruption and allegations of procurement corruption, as you've indicated, and these are 39% and 22% respectively.
Now, which provinces are most affected?
The most affected provinces are Gauteng province with 39%, KwaZulu-Natal 16%, Eastern Cape and Mpumalanga, who have recently went up in our data, are also most affected, coming at 8% apiece.
Now, you did mention that you've received approximately 700 reports, or at least tip-offs now since that 2012, I understand, is the timeline there. The report is named X-Ray, Critical State of the Health Sector in South Africa. Are we seeing corruption being more intensified during this COVID-19 pandemic?
Strange enough, in a little while, a month or so's time, we'll be releasing our half-yearly report in which we look at all the reports of corruption received in the first 6 months of this year. And already we can tell from that in the health sector specifically, we do see an increase in corruption trends. But the cases are still similar. The types of corruption that are trending there is still employment corruption and procurement corruption.
Right. And obviously the vulnerable are most affected by this corruption. I mean, already the state had scarce resources for the sector, but it seems that corruption continues to deplete resources.
Yes, this is one of those things that we have to deal with or contend with if we accept the status quo. If we accept that corruption is our way of life, then we need to accept that our lives are at risk. And the most vulnerable people, women and children specifically, are the ones that are going to be adversely affected.
Now, according to your statement, it seems that procurement and the inflation of prices is one of the most concerning aspects of your research, particularly when it comes to the health sector. Can you just amplify that more and just tell us more about that?
Well, this is 22% of the reports received. And to illustrate the extent to which this is prevalent, in one of the cases that we noted, I think it was in the Eastern Cape, where a service provider was supposed to perform circumcisions for about 10,000 people at about 750, but they inflated the numbers to about 260,000. So you can just imagine how much money they were trying to siphon from the public purse. So these are the kind of cases that we're looking at, and we're also seeing allegations that public officials are asking for 10% in kickbacks if a company wants to be awarded a tender.
Sure. Well, Melusi Ngala, thank you so much for bringing the story to the fore. Researcher at Corruption Watch, Mr. Melusi Ngala.